Hi, my name is David Muse. I am the founder and CEO of a nonprofit organization called Emergency Management by Design. We help small and resource constrained communities with disaster and emergency preparedness efforts. If you're interested in volunteering with us, please visit us on our website at www.embydesign.org. I'm here today to talk to you about MARCs or multi agency resource centers. Today's takeaways are to provide you with an advanced understanding of what a mark is and for you to be able to define it. We'll then use a scenario to talk about the cycle of a mark and specifically mark operations to include planning and preparing, opening, operating, and closing the mark. We'll also talk about and understand how volunteers and stakeholders can integrate into marks as well as discuss resources that you or your communities can leverage to support MARC operations. As we talk about disaster centers, there are multiple types of centers that can be referred to. Today, we're talking about MARCs or multi agency resource centers, but it is important that folks understand what some of the other types of disaster centers are, to include family assistance centers, family reunification centers, disaster recovery centers, as well as volunteer intake or reception centers. We'll spend a few moments taking a look at what a MARC is, as well as taking a look at the purpose, target audience, and services provided for some of these other locations. The purpose of a MARC is to provide centralized support for disaster impacted clients. This can include both individuals as well as families that are affected by disasters and emergencies, and includes things like types of services such as emotional support, client casework referral, distribution of emergency supplies or material resources, as well as information sharing and coordination following a disaster or emergency. A family assistance center is typically seen following some type of large scale transportation related incident, like an airplane crash or train derailment, or following a multi casualty incident or mass casualty incident, an MCI. A family assistance center is intended to provide centralized support for families of disaster victims. And again, the target audience is the families of the victims themselves. Some of the types of services that we might see at a family assistance center include information sharing for family members, receiving client assistance, connecting with relevant agencies if there's some type of NTSB, National Safety Transportation Board, or FBI or other agency involved in the response, as well as receiving emotional support. A family reunification center, its purpose is to reunite separated families during some type of disaster or incident. The target audience here is obviously the clients that are separated, as well as any estranged family members. The types of services we typically see at family reunification centers include registration and tracking of family members, as well as, in some instances, emotional support and information sharing. You might also see or hear about disaster recovery centers. More oftentimes than not, these are during federally disaster declarations, and we typically see these with FEMA or some of the lead state agencies responsible for administering casework. The purpose of the Disaster Recovery Center is to support clients in communities that are impacted or affected by these disasters and emergencies. And again, the target audience is both clients and communities. The types of services we typically see at a disaster recovery center include things like case management, long-term recovery services and planning, possibly financial assistance, housing solutions, and additional referral services. The last common center we would see during a disaster or an emergency is what we refer to as a volunteer intake or reception center. The purpose of this center is to provide a centralized point for volunteer coordination and engagement, and the intended or target audience is just that, volunteers. The types of services that are typically seen at volunteer intake and reception centers include volunteer registration, training, assignments, tracking, as well as other volunteer support services. So let's now move into our scenario. Let's pretend a sizable tornado has touched down in a mid-sized New Hampshire community of approximately 8,000 residents. The tornado was on the ground for roughly 10 minutes and traveled a sizable distance, destroying multiple homes, businesses, and the local elementary school. Fortunately for us, the citizens had advanced warning and were able to take and seek shelter and only sustained minor injuries. There were no fatalities. Let's take a look at some of the damage that was sustained. You can see here that certain parts of the community were completely leveled and that there is tons of damage and debris, as well as many needs of our family and community members. So following the initial response efforts by our police, fire, EMS, and our mass care partners like Red Cross and Salvation Army, local officials identified the need for a multi-agency resource center so that the community can come together to provide coordinated support for their residents and community members. The first phase we'll take a look at is the key actions and planning phase. During this phase, we want to start by coordinating our planning efforts and really work to define our objectives and the scope of what the MARC is needed for. The second step in coordinating a MARC is to include partner representation and engagement. It's very important that stakeholders and our partners are brought into the fold early on in discussions so that they can be a part of the planning process and that we can identify and understand what types of resources they have available and can be leveraged during our MARC. The third step in the planning process is to identify a location and ensure that any local preparations need to be made. Many times we'll often see a school, a gymnasium, or some type of large venue that can be leveraged that has tables and chairs and maybe even a feeding area for a MARC. And that's been very successful. The last step in the planning process, once we have all of those details identified and worked out, is to conduct public outreach and messaging. Even though the service is greatly needed and there's some exigency in opening up the MARC, we do want to be mindful and make sure that we provide our residents and community members with enough advance notice that they can make appropriate arrangements to come to the MARC to receive services. A lot of times we'll typically provide at least 24 to 48 hours advance notice, although working with media partners and other folks that can spread the word, providing some advance notice is absolutely warranted and very beneficial. Those are the 4 common key actions that we'll see during the planning and preparedness process. Let's take a look at our scenario update. So after we've planned for our MARC and we've advertised it, the MARC is now open and clients of the impacted area have started to arrive and receive services. They are greeted at the registration desk by a friendly staff and fill out essential documents that can be shared between all participating organizations. One of the best practices out of coordinating a MARC is to have all of the agencies or organizations that are at that MARC facility come together and try to streamline their forms so that it minimizes or mitigates the amount of forms and paperwork our clients need to fill out. So a lot of times we'll create some type of primary document that captures the majority of the information that these different support agencies and partners would need about the client or their family. And then we make photocopies, and with the client's consent, we share that information with our partners. So it's a win for the client because they don't have to keep filling out the same information. at each of the different stations or tables at the MARC. And it's a win for our partners because they get the information that they need to deliver essential services to these clients. So, because we're at the point we're operating the MARC, let's talk about some of our key steps for operating. The first is to make sure the coordination of services and resources are available. And I spoke about that a few minutes ago. We don't want to ever invite somebody into the MARC that is there to sell a product or charge some type of fee for service. And vetting those partners and stakeholders before they come in is essential part of the process. We also want to make sure that we're well-rounded and well-represented in the types of services we're offering. If everyone is there offering feeding assistance or clothing assistance, clients might have other needs like lodging or mental health, spiritual care, help restocking or prescriptions, things to that effect. It's really important that we take a holistic approach to the services. We also want to make sure that our volunteers and our partner organizations are integrated into the MARC operations. A lot of times we'll do this ahead of time to make sure that our volunteers and our staff members that are working the MARC have some type of proper identification, whether it be a name tag, some type of lanyard, or maybe even a t-shirt or vest. I spoke a little bit earlier about case management and client services. So in this instance of a tornado, thinking back and reflecting on the scenario we reviewed here, thinking about what type of services our clients might need. Following a tornado, they might need things like housing. They might need things like food, clothing. Everything looks like, from those pictures or the video clips we saw earlier, a lot was destroyed. So connecting these clients with whatever resources they need is absolutely essential. A lot of times too, people have, they'll lose things like important documents. So information about bank accounts, identification cards, things to that effect, passports and other legal documents. So making sure that we're involving the appropriate agencies so that they can come out and hopefully begin to work with these clients as well. Many states and government agencies that produce these documents have contingency plans for how they can reissue these documents out to folks. But making sure that they're involved in the planning process and they're coordinating services the day of is absolutely essential. And finally, the clients coming in to receive services might not just be looking for services, but might be looking for additional communications and information sharing. So it's really important to make sure that there are government officials and representatives there that can anticipate and are prepared to answer questions like, when will this debris be removed from my house? When will I be able to get back into the affected area? What is the plan for XYZ? So thinking through some of those things ahead of time and making sure that there's somebody there that can answer those questions for clients is absolutely essential in delivering and operating a multi-agency resource center. So let's move on in our scenario a little bit. Over the course of 5 days, our MARC welcomed 400 clients, which was 5% of the total town's population. That's roughly, I believe, 80 clients per day, which is not an unreasonable number for a MARC to see, especially one that's very well organized and as put together as ours because of the planning efforts and this training that helped prepare us to operate a MARC. Emergency management officials working with critical stakeholders have coordinated and conducted focused outreach to the impacted clients and believe those clients have received the services of the MARC. The MARC is now, a decision's been made to deactivate it. So some of the key actions and considerations in closing the MARC. First is making sure that the decision-making to close the MARC is one that is coordinated. So working with local public safety officials, local emergency management, as well as those other volunteer agencies and organizations out there delivering casework and client services in the the client population themselves, making sure that we've done everything that we can to offer these services to the clients and making sure that there's almost a unanimous decision to scale down and close the MARC. The second piece to closing, and this really needs to be thought about during that decision-making process, is thinking through the transition of services and the resources for the clients. Clients will have needs that extend far beyond the time frame that we're offering the MARC. So thinking through how we can go about connecting those clients with those services is absolutely critical. And being able to communicate that out to the clients before and during the closing period is very, very important. A lot of times 211 is a great partner that will refer many clients to, because 211 has lists of services, and they are able to identify and understand what the client's needs are, and a lot of times make appropriate referrals there. So make sure to include 211 or a 211 representative when you're talking about transitioning of services and resources, as well as even maybe in your advanced MARC planning and MARC operations. And then finally, one of the key actions of the closing process after the facility has been returned to its normal state, everything's been cleaned, and the documentation's all taken care of, is taking the time to review or conduct an after action review process. During this process, whoever the MARC manager is should be working with local emergency management officials to conduct a formal after action review to identify strengths, areas for improvement, and other potential best practices, so that if a MARC ever needs to be activated again within that community, we've captured those lessons learned, as well as any subsequent improvement items and things that can work to help streamline operations going forward. So let's talk about some resources that are out there. If you were to just do a simple Google search of Multi-Agency Resource Center, many states have published toolkits and templates and resources out there. Much of the information that was discussed today came from two primary resources. The first, the Multi-Agency Resource Center, or MARC Planning Resource, and that's on the National Mass Care Strategy website. The second is from the International Red Cross and Red Crescent Society, and they have a MARC planning resource toolkit available as well. Take a look at what your states and local EMA or emergency management agencies also have to offer in this space, because while a lot of the principles for MARC operations are similar, some states and some communities decide to do them a little bit differently. But these two resources are ones I've particularly found beneficial. I'm always happy to talk about MARCs or emergency management in general with anyone. So my contact information is here. Again, I'm the founder and CEO of a nonprofit here in Southern New Hampshire called Emergency Management by Design. And our goal is really to get out there and make sure some of our smaller and more resource constrained communities have the planning, training, preparedness, and other resources they need to be successful during disasters and emergencies. So if you want to reach out, our information's on our website, or it's also included here. Thank you very much for your time, and thank you for the volunteer services that you provide, not only to your local communities, but to the larger state of New Hampshire. Thanks again.